Three branches of our trigeminal nerve, ophthalmic, maxillary, and those have purely sensory functions. But the mandibular branch, which goes down towards the mandible, had both motor and sensory capabilities. Okay, so it's gonna let us feel, but at the same time, it's also gonna activate those muscles of mastication. So the one that's underneath these auricularis muscles is gonna be the temporalis muscle in that temporal fossa. So we can see it right through there. Comes down underneath that zygomatic bone, goes down to the mandible. So temporalis. The next one we can see right through here is the masseter. There's the masseter right there on top. So it's on top of the mandible. And don't forget, on top of that, we would also have our parotid gland sitting right there on the top. Now, I hope you forgive me because there's one muscle I forgot to say a minute ago, which is the buccinator or the buccinator. Say it however you want to, but it's kind of like you puff out your cheeks. That's what you're pushing against, the buccinator. We talked about it, I think it was 2 weeks ago in lecture when we were talking about the oral cavity. We said we'd talk a little bit more about it once we get to this part. Now, that's not one of those muscles of mastication. Now there's a couple other ones that we want to see, and they're the pterygoid muscles. So I'm gonna try to show you this from a couple different angles. Okay, so we're gonna have to go a little bit deeper to be able to see these muscles. The pterygoid muscles, if you remember, are coming from that medial and lateral pterygoid plate, which is associated with the sphenoid bone. We just saw the tensor vali palatini kind of wrap around that plate itself to get to the soft palate to provide tension and kind of elevate the palate. These guys, however, are going over partially to the temporomandibular joint for the lateral part, and then the posterior angle of the mandible is getting the medial pterygoid. So that's nice because this medial pterygoid goes to the mandible. And then lateral pterygoid is going to our temporomandibular joint. So in order to get there, I've got to go deep, right? Because those plates are very deep. So let's uncover these layers, get rid of the mandible. And then as I do that, the first thing I can see right here is the medial pterygoid muscle. Medial's going to the mandible. And then the lateral is going to be going over to our temporomandibular joint. Okay, so there would be where the lateral is. Let's see if we can just isolate it out so we can see it. So that lateral pterygoid muscle is going over to the temporomandibular joint. Where the mandible is sitting in that joint, there's actually a little biconcave meniscoid-like disc. So it's a small disc-like structure. And it's meant to help kind of cushion the jaw and give it some protection. But it's possible for that to actually move posterior. And if it were to move posterior, that would mean that if my jaw drops down out of the fossa, then it won't be able to go back in, because now the disc is in its place. So a patient who can't close their mouth all the way, disc is going posterior. If that disc were to move anterior though, they might have trouble opening their mouth. So if we take our fingers and we put them right in front of this part of our ear, and we just slowly open our jaw, you can feel those condyles slip out. Now, you may notice that your left and right don't open evenly. Okay, that's a good indication that one's kind of stuck, or possibly that disc is not where it's supposed to be. When you take upper extremity adjusting, you'll learn how to evaluate that, and then you'll also learn how to do manual adjusting for it, okay? So one way to adjust is by hand and actually move it back. If they won't close, believe it or not, you really just put your fingers here, have them slowly
close, and then you just set it. Sometimes there'll be a big click, sometimes there won't be, but you just kind of set it back behind that disc where it's supposed to be. It works pretty well. The other one, you'll learn how to do it different, where you kind of go along the angle, and it's kind of a complicated like dance move, you know what I mean? And if you're not really good at dancing, you can mess it up, right? So they won't tell you this in the class, but if you wanted to, you could pull out an activator. You could pull out an integrator. I wouldn't use like the ones that go I wouldn't use that instrument. Okay, but you could use like a single click instrument to do the same adjustment. It might give you a little bit more control of what you're doing. But however you do it, it works pretty well. I'm bringing it up because this pterygoid muscle associates or is connected to that temporomandibular joint. And in some states where you're allowed to go inside people's mouths, people will go in and they'll actually trigger point that muscle out. They call it stripping the membranes. So they'll go in and they'll actually trigger point the muscle, and that addresses the temporomandibular joint dysfunction as opposed to adjusting it. I've had someone who they had that done in Florida, then they came to Georgia, or no, South Carolina, and we weren't allowed to go intraorally. So I just used the regular adjustments that had been taught here, and they worked just as well. So again, which one works better? I don't know. Maybe it'd be great if we could do both at the same time. I don't know. I didn't get to do that in South Carolina, but so lateral pterygoid muscle, again, it's moving lateral. When we look at the model, the medial one's gonna kind of look like it goes lateral, because it's coming out here. Okay, because my TMJ is a little bit more medial. So don't let that confuse you. Remember, medial pterygoid goes to the mandible. Okay? Lateral is going to the temporomandibular joint. So those are all the muscles of mastication. Remember, those are going to be innervated by the mandibular branch of the trigeminal nerve. The other muscles, which are muscles of facial expression, are going to be innervated by the facial nerve, and we're going to see those nerves in just a few minutes, okay? So what I'd like you to do now is go back to the tables. I believe we got heads pulled up on most of them. Go through and build that. Okay, if you want to, you can take pictures of what we have here. That's fine too, I don't care. I've got this currently saved under our settings.